My name is Sarah. I'm an occupational therapist at Kingston Hospital in the Orthopaedic and Surgical department. So communication, we believe, is really important in healthcare because we have so many moving parts, different therapists, different members of the MDT, different members of family, for patients, all sorts of clogs that have to work together. Well, we've only just started using it, so we're relatively new to it. So far it's been really helpful because at the moment my team doesn't really have any other means to communicate with every individual member. I'm lucky enough to carry a bleep, so the old-fashioned pages, but my other staff members don't. So this is something that we've been able to utilize so that I can see where they are in the wards, to see how they're managing their caseloads or if they need any help really, and that's been really useful. It's made it a lot easier for us to get hold of each other, especially in between caseloads, and it's quite nice not having our bleeps go off when we're with the patient. It can be quite an alerting sound for some of them. So some patients require assistance of 2 people, some only 1. Sometimes you don't realize that till you've got the patients up and you're in a more precarious position than you would like. So that's where we've mainly been using it. In terms of ease of use, it's very simple, and I was able to set up an account really quickly, similar to some of the other social media accounts that I've had, because I had initially suggested WhatsApp, which is not a secure line. So this is much more user-friendly in an acute setting and an environment where we need to be confidential with data. Kingston's quite a big hospital, so even just coming from one department to the next can take some time. Whereas if you're in the situation where you can just remove yourself from the patient for a little while, send a text message out, and then carry on with either alternative work or link in with communicating to someone in the department about have you seen anyone available, because there's quite a few of us on the app as opposed to just my team. So sometimes we'll send like a shout out, has anyone seen this person, in terms of linking in with seniors support. And I think in that way it's made it a little bit easier for patients, not having to wait such long periods for us to get maybe some of the personnel that they would need for treatment or alternatively equipment or whatever it is they might need from us as therapists.